How are you, sir? Good to see you. Great to
be
have you
with
with
you.
us today. I don't know if you heard any of our conversation there, but it's pretty amazing. I think we're very lucky to have as sharp a scientist and as passionate an advocate. You are also an advocate of work, and look, I don't want to, pre-frame this, but I know a lot of folks in Congress, and you're one of the ones obsessed with this issue of opioid addiction, mental health, and you are rare because there are not a lot of you up there that have these obsessions, and I'd be interested in how you became the way you are.
Well, I think a lot of it was by personal stories that people exchange with you, but in some cases, individuals that I knew as neighbors and friends who had succumbed to the illness. And so I think it becomes very important. And when you look at the data, those data are compelling. They tell us that we do have a crisis at our hands, and we have an epidemic. And if we're going to utilize those labelings, let's act accordingly, and let's respond in crisis proportion. So I think it's important for us to look at that three-pronged approach, Steve, that includes prevention, includes treatment, and includes recovery. And there needs to be an acknowledgement by policymakers such as myself that for many, this will be a chronic situation. It will be a lifetime of treatment in order for them to address the illness that impacts them. And when we document those numbers, I think 2016 or 17 statistics are the most readily all intact. It showed that we may have plateaued at about 70,000, but then some indications that we may be rising again. And so that should behoove all of us to put our best foot forward.
What does the demography of that look like? You know, I was again just mentioning that I've been both disturbed and trying to understand why you can have within one metropolitan region like Baltimore such incredible difference in life expectancy by zip code. And you look at the zip code challenge, which determines now so much. I'm just interested in what you've seen in New York. What's the demographic?
Well, the demographics will show that every age group is affected, every background and economic strata. But there are some clusters by communities, and who knows why that may be taking hold. But I think that when we do look at appropriations measures like that our late friend Elijah Cummings had done with Senator Warren, we need to not only pronounce the appropriations level at a level that is going to conquer this epidemic at $100 billion, but then $100 billion, but then also to put together a focus where there's more impact for those hard-pressed areas. We've identified those, and I think that we should structure it so that more money goes into those communities.
So you've been part of two big acts that have passed, the Comprehensive Addiction and Recovery Act and the Support for Patients and Communities Act. Is the administration, the Trump administration, friend or foe in this process?
Well, we've written the president, we've talked to him on the House floor when we had the State of Union message, and I would like to see a more aggressive response.
What would that look like?
I think it should be, it's first focusing on the need to continue prevention, making certain that there's not this rollback or cut to the substance abuse prevention and treatment block grants for communities or drug-free communities activities. I've seen success stories in communities in my district, specifically I could name Troy and Niskuna, New York, as great communities that have put together drug-free communities activity. Those dollars shouldn't be rolled back as the president has proposed.
So explain this, and pretend we don't know about all of the acronyms, and we have lay people watching online right now. What is the impact of Medicaid block grants, of what they're doing to move to a block grant format? Well, how do our friends that are in the room that are working in the front lines of community, we have drug companies here, how is that world impacted by that? Or are we inventing drama that doesn't exist?
No, we're not inventing drama. It's very important to continue these block grants because on average, I think it's about 70% of the activity that is generated at the local level is driven by those federal funds. For many states, that is 100% of their prevention activity. So if we mess with that number, we may be wiping out their whole process. I think that's important to hold in mind. And then again,
And do your GOP colleagues and friends across the aisle understand that as well?
there's bipartisan support for these legislative items. I think that we need more robust advocacy from my colleagues, but it is a bipartisan support thing because, again, the human stories are what drive this, and the emotional impact and the awareness that we have a drug crisis, an opioid epidemic in our hands, should move us to appropriate policy action and resource advocacy.
We have some folks in the audience from the National Council on Behavioral Health dealing with mental health, and I'm a big fan of that organization. And the mental health picture is another part of this puzzle piece of how do you get, deal with the health of a community, move towards more healthy embrace of some of these issues. And that's another big area that you're concerned about, which almost no one wants to touch.
Well,
Roy Blunt and Debbie Stabenow were, at least in the Senate side, I know you may have been the House partners, began moving forward more centers to deal with mental health. I think it was as they both described it, a toe in the door. And what's the state of support and federal partnership on mental health support in the country?
Well, having the benefit of working with mental health policy when I was in the New York State Legislature, we were able to champion the first mental health parity bill in the country, which required that if you're going to offer insurance in New York, the mental health component has to be on par with the general health component. That then was followed by the federal legislation, and now some other states have picked up on that activity. I think that in and of itself began to address the stigma that is associated with the mental health formulation, and also drew an awareness that there's this overlap with addiction, suicide prevention, and mental health policy. I think that all of that needs to be understood to be the kind of wraparound that we need so that it's inclusive in responding to the needs of those who may struggle with the illness of addiction. Much of it may be linked to mental illness or mental health disorders. So I think that it's important for us to continue to monitor the effects of and the inclusion of mental health parity legislation. We don't want it to just be a buzzword. We want to make certain that we truly are weaving into budgeting bills or general policy in a way that recognizes that that concept needs to be fully ingrained into the operations of the effective agencies.
Did you watch the debate last night?
I saw parts of it.
You were lucky.
That I didn't, that I saw only
I don't mean
half
to be
of it.
trite, but it was terrible. I guess my question is, in the healthcare overall, is the number one issue people have anxiety about. And what's interesting, unless I'm mistaken, I'm always mistaken, there's been so little discussion of these issues as part of the healthcare debate, right? We talk about healthcare in this kind of big, generic, blue label way, and Medicare for all, Medicare, Joe Manchin tells me we can't even afford Medicare for some. But when it comes to something as endemic and big as opioid addiction and all of the factors that contribute to that, mental health questions, I haven't heard from any of the leading Democratic contenders anything on those fronts. And I'm just interested in what you think about that.
Well, I think it's tragic that we're not talking about this in the context of a presidential campaign, either camp, either side. And I think, again, there needs to be an acknowledgement that if we're going to see this as a crisis, we need to respond accordingly. And it begins with treatment. We still have 20% on average getting treated in that moment of clarity. There needs to be treatment on demand available for 100% of that addiction community.
So explain that treatment on demand piece of this, because I think a lot of people may not know this is another thing you're advocating for, which is to get this waiver. Explain this waiver issue.
Well, there's service providers that are required. What we did in the recent past, was to improve that by lifting the cap that was artificially imposed, or
explain the cap.
Cap on medical, the MDs in terms of 100 patients that could be treated with the medication-assisted treatment formula. We raised that to 275 and added disciplines, Steve, like physician's assistants and nurse practitioners. So that began to grow the service community and hopefully the service response so that those numbers of 20% would be vastly improved. But beyond that, we need to make certain that some of the burdens that rest in the way of getting treatment to people be taken out of the format, such as this mainstreaming addiction treatment bill, which would take away an outdated requirement, a waiver that you go for this training at DEA. France, for instance, had such a requirement, and as they removed it, there was, I think, an improvement of 76% in terms of treatment.
79 technically.
Is it?
Yeah, I just did my research, so it's
Oh,
79.
good for you.
Yeah.
Good for you. We'll take a higher number anytime.
Showing off, yeah.
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 But, you know,
Yeah.
I think any of these artificial barriers that stand in the way of treatment need to be taken away.
Right.
You know, why focus on one particular treatment activity when we can get treatment to those out there with the community that has been adequately trained, licensed, experienced. We should enable them to provide services in this whole aura of treatment shortage. When I meet with the addiction community, the first thing individuals will bring to my attention is the inability to secure services in that moment of clarity. And I think that is a totally unacceptable measurement. It's an outcome that is regrettable. If we had that going on with some of the more traditional medical cases, diabetes, if we did not provide insulin for 80% of the diabetic community, there would be outrage. There would be, you know, screaming at the policy makers. I think what we need here is to acknowledge that we can help, we can remove burdens, we can make access to treatment more available, and that ought to be our given goal.
You know, Paul, the other dimension of this, and I don't know how I'm going to get into it, but I'm just going to do it, that I've been very impressed with my research and whatnot with Nora Volkoff, and we just had a conversation
She's an
here.
impressive leader, and we're lucky to have her.
This notion of social embrace, it sounds like it makes sense, but it just sounds so unreal to me, because another area the Hill has been exploring is sort of the second chance economy, giving people another chance to work. Work is part of a lot of folks' identity. And if you have been a drug user, if you have been judged in some way in connection to addiction, if you have mental health issues, if you've been incarcerated for anything, you've got a knock on your resume, you've got a knock on your profile that makes very risk-averse human resource departments unwilling to hire. And I'm interested in that social equation, because social embrace ought to somehow find a way to give people another chance, and maybe even another chance. And do you look at that in the same way I do, of like connecting the economic question with the challenge of helping people through recovery?
Absolutely.
Is that a fair question, folks? Yeah, okay, good.
Absolutely. I think the socialization of it all, the recognition of addiction as an illness, looking to the research that has already been done that suggests that there's weaknesses in certain lobes of the brain. This ought to bring us as a sophisticated society to the realization that people are recognizing their illness, they're getting treatment, and there ought to be hope provided in the equation.
So
hope is incredible.
should there be something done on that? A buddy of mine, Jim McKelvey, who co-founded Square, you guys, some may use Square on your phones, he found that people he was training to code that had some speed bump in their lives, had got incarcerated, weren't getting hired. So he was sort of a celebrity. He called, you know, CEOs of companies and said, your HR departments are not hiring highly talented people that I've trained. And he turned their lives around and be getting them hired. And I'm just wondering, do we need, as part of the issue of responding to those, particularly today we're discussing those that have suffered with opioid addiction, do we need Paul Tonko? Do we need, you know, some celebrity CEO? Do we need someone else to begin calling folks and say, hey, take a chance on these people? Because if you don't do that, if there's not a proactive step, I'm just wondering, you know, are we just kind of, you know, noting something and just letting it float by?
Yeah, no, I think what you're calling for here is an acknowledgement of rehabilitating the individual. And what I see happening in many of these programs is a structured individual that is much more sound, simply because of the programming efforts that were made. And, you know, we should all have that kind of structure in our lives, as those so-called normal that are readily available for the workforce.
Before I go to the audience and take some questions, what are the 2 or 3 most important things you want the administration to do or acknowledge in making this a
Well,
better
I want them
picture?
to pay strict attention to the fact that the Energy and Commerce Committee this week will be reviewing 2 of our bills that I think are important. The MAT bill, the Mainstreaming Addiction Treatment Bill, which I think goes a long way towards releasing talent and allowing it to go to work, and then our reentry bill for those who are incarcerated, which is many times the outcome.
So
for
both
our
of
loved
those
ones.
bills are in committee this week?
Right.
Being marked up?
Right. So we're having a hearing.
Oh,
on
hearing,
it.
okay.
So basically, with the Medicaid reentry bill, many of our loved ones enter into that sphere of incarceration. It's akin to the illness. For those who are incarcerated, it's important to note that they're at risk when they're released, perhaps because of the physiological adjustment that comes. But there's a 129% greater chance that you will die of overdose within 15 days of release. Of the nearly 5,000 jails in the country, about 44 have active programs. So it's regrettable. What we need to do, I believe, is provide for a 30-day notice before release so that Medicaid-assisted treatment can begin, that they can be tethered to programming, and that we can save lives and address those lives with dignity.
Do you have Republican allies?
We have a bipartisan bill that has, I think, over 100 sponsors now.
And so allies on the committee?
Yes.
Allies in the administration?
We'll say, I don't know.
Allies in the Senate? Republican?
Yes, we've been talking to both sides of the Senate.
So you've got, better chances than most.
Well, we would hope. I would hope that everybody in this decision-making process, from executive branch and legislative, would be supportive of common sense legislation that allows people to have a sense of hope and have treatment made available, and to, again, address these lives as lives that are severely impacted by a very difficult disease.
One last short question. Coronavirus, another public health abyss that we may be looking at. Given your interest in public health, what are the things you want your colleagues to pay attention to right away?
Well, I think obviously we need to do the research that will develop the vaccine that will get us to a response which could grow into...
Well, that's happening. I mean, I think one of the questions is whether you put money into scaling that fast with government support, right?
I think scaling it as quickly as we can is important.
Let me go to the audience.
Sure.
Questions, comments,
Good
thoughts,
morning,
reactions?
everybody.
Good morning. Right in the very back. Yes, sir.
Thanks.
Who
Hi.
you are.
I'm Salman Rohani. I'm with the Pew Charitable Trust Substance Use Prevention and Treatment Initiative.
And thank you for what you do. I know about it. I was reading a report you guys did, so thank you.
Thank you. I don't know if it was me, but
You should take credit.
there's many smart people on our team.
Yeah.
So part of our work is going into state and working with state governments to understand what they're spending their block grant funding on. And a common anxiety we hear is, this funding is great, but it's going away in 2 years, and that anxiety kind of trickles down to the community level. So we advise frequently on what programs to make more sustainable through Medicaid funding or other things. Has there been guidance from Congress or anyone who's distributing those funds on which types of programs should be made more sustainable in the long term?
Well, let me begin with the whole block grant issue. I think it's vulgar that we would play with those funds, especially because of the audience we're attempting to serve. And as I made mention, it is, for some states, far too many, 100% of the work that they do. So to mess with those funds is to mess with certainty and predictability, which then destroys the whole mechanism of providing hope for individuals. In terms of waivers and allowing for other sorts of programs, I don't know if you're going to get those directions, but certainly the state initiatives coming toward the federal government, requesting for waivers, as my home state of New York has done with the Medicaid program for incarcerated individuals. I leave it to states to be very aggressive, but I would encourage states to really get on our case to expand the dollars to at least by 500 million for the block grant situation.
Right here.
Hi, I'm Liz Cairns. I'm with Center on Addiction, Partnership for Drug-Free Kids. Thanks for being here. Thanks for championing this cause. You mentioned a couple of bills that are coming through committee. I wanted to also call out, speaking to the support for families, family services, community of embrace, there's a bill coming through committee, we just got word, called the Family Support Services Act, and just wanted to bring that to everyone's attention.
Who's pushing
Thank
it?
you. Senator Gillibrand.
Okay, good to know that. Thank you very much.
Thank you.
Quick comments. I'll give you the last word, Congressman.
Well, I think that anything we can do to reinforce, because these illnesses are oftentimes impacting an entire family, I think it's important for us to have the resources so that people can cope as they go forward. I've talked to a number of families that have acknowledged in very painful measure what it means to their whole quality of life, to their stability. The impacts are severe. Whatever we can do to make certain that it's an inclusive approach, I want to do. But it's time for this country to recognize mental health, addiction, and suicide prevention as dynamics that are very real, and they need the reinforcement of policy, appropriate policy, and resource advocacy.
Well, Congressman, I want to thank you on behalf of all of us. I mean, I think we're doing this because this is an important issue, and as I started out, I feel like it's one that comes out every once in a while. People line up, but I look forward to you mainstreaming this with many more of your colleagues and making it an everyday concern. So
well, thank you, Steve. I think it also is good for, you're most welcome. It's very good for the media and the outside world to become very, very much into the advocacy. And so I appreciate your involvement and the Hill involvement to, again, throw another pebble onto the pond so that the ripple effects of sound thinking, of compassion, and science-based and evidence-based opportunities are embraced wholeheartedly. So to all of you here in the crowd, thank you for being those agents of hope.
Ladies and gentlemen, Congressman Paul Tonko, thank you so much.
Thank you, Chief.